the respiratory anatomy is responsible for the breathing cycles so that we can have gas exchange to help support the cells of our body. For communication, our breathing cycles modify to meet our voicing demands. So it provides the air to vibrate the vocal folds during voicing, which we'll talk about in detail in the phonatory section, but it also modifies during swallowing. So when we're swallowing, if you swallow your spit right now, your breathing actually stops to keep that spit from going into your airway and directing it towards the food pipe. And then immediately after you finish the swallow, you exhale, so that if anything got in there, it's kind of a natural built-in protective mechanism to expel anything that got into the larynx or the trachea. For phonation, it not only gives us the vibration of the vocal folds, it helps modify so that we can speak very loudly, or speak for a really long time, or whisper. So when we talk about the respiratory anatomy, we can talk about the overall thoracic cavity. So the thoracic cavity begins at the bottom of the ribs and goes to the top, or to the level of the clavicle or the collarbone right here at the top. Here you can see it a little bit better. So the thoracic cavity is really formed by the 12 pairs of ribs that give us the rib cage. So starting up here at the top, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 11, and 12 are here in the back, but don't actually attach to the thoracic cage. That gives us the thoracic cavity. And here in the middle we have the sternum. Inside of that we have the lungs. We have the right and the left lungs, and those lungs attach to the trachea, which attach to the larynx, which attaches to the pharynx, which attaches to the mouth, so that we can get air into the lungs. The driving force behind that is the muscles. We have the diaphragm here at the bottom, which is our largest contributor to changing the air pressure for breathing. And then we also have muscles or intercostals that attach to the rib cage to help expand the rib cage. So we'll go into detail later in our phonatory section for additional respiratory information.